My name is Collette O'Brien. I'm a registered dietitian and I work in the Cookit team in Southern Health and Social Care Trust. My job is actually really varied and I have lots of different roles. One of my main roles is to work with community, voluntary and statutory organisations to roll out and train facilitators up to be able to deliver our community nutrition education programmes. So for example, Cookit, Food Values and Good Food Toolkit. Probably a couple of things really. One of the favourite things is that I get to see on a day-to-day basis how my work as a dietitian actually makes a difference in people's lives. So for example, for community nutrition education programmes, when we go out and visit those programmes and see them in action, we get to hear our participants' stories about how coming to a Cookit programme has changed their lives. It has helped them learn new skills, they feel more confident in the kitchen, they're saving money, they can actually make healthy low cost meals, and that has a real impact for them and their family, and also helps them make them changes in terms of their behaviour around food. So another favourite part of my job is actually the variety. One week is never the same as the other. A couple of weeks ago, for example, I was involved in producing a podcast which along with my colleague was looking at healthy eating advice for people who had stopped smoking, and also looking at practical nutrition information and advice for people on top tips during COVID. And then the week after, I was lucky to be asked to provide expertise for a short film that the Consumer Council for Northern Ireland are making on food poverty and food insecurity in Northern Ireland. So I absolutely love that variety. Probably one of the projects that I am most proud of is the work that I did developing the BME, the Black Minority and Ethnic module as part of the Cookit programme, which was rolled out across Northern Ireland. That work took a couple of years, and I had the opportunity to work with 6 ethnic groups. So they were the Bulgarian community, the Chinese, East Timorese, Polish, Lithuanian and South Asian community. As a dietitian, that was a brand new experience for me. It was a steep learning curve and I learned a lot. But doing that work and now it's integrated as part of the Cookit programme really has given our tutors and our facilitators the confidence and awareness and skills to be able to know more about food within those cultures, and also to provide culturally appropriate advice and recipes. And it was fantastic and it was really enjoyable. Working within HSC is really enjoyable. I love it. I'm fortunate in that I have been doing this work for a long time. I get to work with lots of different individuals within our organisation, and even outside the organisation, so folk within council, community and voluntary groups. And I'm passionate about what I do. I'm passionate about being a dietitian that works within public health and making a difference. I would say go for it. It's a career that provides great scope for further training, further learning, having the opportunity to work in a variety of areas, whether that's paediatric or renal dietitian or within public health. So I would say go for it. It's a very rewarding career, and if you're passionate and you have an interest about food and nutrition, then it's really great.